Hello.
Hello.
How goes it?
Good. We're not videoing right now, are we?
Oh yeah. But
yes,
it all gets edited out. I mean, it's if you f up saying something or you
I will f up many things.
There's
I'm
a couple.
Just edit that shit out.
ER particularly is one of those specialties that's got a lot of action.
I think when TV shows, they are showing what the nurses do, but the doctors get all the credit for it.
Exactly.
I'm sorry, doctors don't sift through poo.
Yeah. Grey's Anatomy or On House, a whole team of doctors come rushing. I'm like, nah, that's not ours.
No, nurses are first. Nurses are there first.
Exactly. Right now, you're working in adult ER, and you came from Pediatrics.
I did.
And how long were you in Pediatrics?
So my dad's a pediatrician, so I've kind of had this convoluted healthcare story. I grew up starting off when I was like 3 and 4, going on rounds with my dad at the hospital.
3 and 4?
3 and 4 years old.
Wow.
Yep. So I'm very, very comfortable in hospitals. I went to school, did some sciences, decided to take some time off to make sure that medicine was really what I wanted to do. I worked as a dialysis technician, worked at Seattle Children's. This whole time I'd been working at my dad's practice on and on, his pediatric practice, since I was 16.
Doing what?
He made me work from minimum wage, starting with filing,
paper
basic
pushing, that kind of
thing. Exactly. So I really had a good understanding of what like actual practice is.
I think that's so important because a lot of people don't realize how much goes on behind the scenes.
Sure.
By the time you got into nursing, you got your feet wet in a lot of different areas.
I had my hands in a lot of different pots. I've kind of done a lot of everything.
That's super good. You get a lot of nurses that come fresh out the gate going into nursing school and just don't understand how the whole hospital works. And I always say shadow and really try and get yourself a job within the hospital before you finish nursing school.
You'll be a better nurse and you'll be a better teammate.
Absolutely.
Just to have that working
knowledge.
You know,
I worked as a unit coordinator and that gave me so much insight. I was so nervous back in the day to go in patient rooms and stuff like that just to get information from them.
The nurses and the doctors are gods. I did unit coordinator also while I was in school, and getting actually to have some exposure to patients, seeing where you want to end up as nursing or as part of the medical staff. It was an invaluable experience to me, and I'd highly recommend like volunteering.
Working in pediatrics, a lot of years, as you've said before, it's not common for nurses to make that shift from pediatrics to adults.
No, I am kind of a lone ranger.
Yeah, and I noticed that. And what made you decide to do that?
It was like one of the hardest switches that I had to do. I have job ADD. I like the ability to do lots of things, and I don't like to be pigeonholed down one avenue, which is why I've stayed in ER as long as I've stayed, just because it's always like something new every time you come into work. Right now, my tentative plan is to do family practice because I really want to be able to be competent and be like a bedside provider still. However, I'm thinking at the same time to be able to concurrently get like a master's in business administration or health informatics, because I'm also very interested in policy and changes, and I honestly like raw data and seeing numbers and how that might change the healthcare delivery that we have.
That's a lot.
That's a lot.
That's a lot.
I might be biting off more than I can chew.
Well, have you done that in the past?
Bite off more than I can chew? Oh yeah. I decided one year that I was going to be a runner, and from never running a mile in my life, I went and trained for the hot chocolate run. And
what is the hot chocolate run?
It's a little run around Seattle where they reward you with hot chocolate and fudge and marshmallows at the end of it. How have
I not heard of that?
So I trained for that like after never running. And then in 6 months I decided from 0 to I'm going to run a marathon, which was real stupid. There's a reason why people run for a couple of years before running marathons. Like
or like
joints and ligaments. And now I'm training to Summit Rainier right now. So it's a problem.
Dude! There's a lot of frustration with people when they come to the ER, whether it be something severe or something not so severe. Been waiting there for 2 hours, and then someone that's been there for 5 minutes gets wheeled back first. And they walk up to the triage desk and they're like, what the fuck? Why is that?
ER, unfortunately, folks, is not a first come, first served basis. We take things based on acuity. I joke about this, but it's kind of serious at the same time. If you're not blue, you're not going back first, right? ER functions on ABCs, airway, breathing, circulation. That is how we prioritize. And the ER triage nurse's job is to make sure that people, when they're checking in, are being brought back appropriately. So if you've been vomiting for an hour, I'm sorry, that sucks. But somebody that is having chest pain or is not able to breathe, that is a priority. What I like to tell people when they're checking in is if you're not being back first, that's actually a good thing because it means that you're stable enough where I feel comfortable for you to sit in my lobby.
Exactly,
I think that should be a reassuring thing.
It's called an emergency department for a reason.
It's shocking there's emergencies that happen there. A lot of people are bounce backs, right? Because they don't get adequate discharge teachings. As a nurse or as a future nurse going into it, you know, if you really think that every time you're in the room that you have the potential and you have the power to reduce a patient's need to come back in the future if you give them the right information and the right tools, it's easy to not. And I can see where that would be an area that I think we all could be better at.
Let's talk about the play-by-play in a pediatric ER. What is it like? Say they're brought in by ambulance.
Peds and adults that way are the same. If you've got somebody coming in by ambulance, you have all members of the team in the room swarming or at the bedside kind of at the same time. The big difference is when you're an adult and that happens, that's not really scary. But when you're a kid and you see crap tons of people in your room, that's really, really freaking scary.
Gotcha.
When I'm that primary nurse during one of those swarms, I try and really, really get in with the child and the parent. Try and like push out all of the background noise. They're there, but try and focus on that kid so they can gain trust, because gaining trust of children is so hard. It is so hard to build rapport with the little PD people because they don't trust easily, as they shouldn't, you know?
They don't know who we are, what we're doing.
Right. They have their little defenses up, and kids maybe not be like verbally articulate, but they are incredibly smart and they know things that they shouldn't know, and they know when they're comfortable. So I try and build that it's okay, I feel safe, I know you're here to help me thing. When kids come in, it's respiratory illness all of the time.
That's the most common
complaint
that you see come
asthma,
in.
exacerbation, bronchiolitis, pneumonia.
And so you get pretty familiar with treating that.
Oh yeah.
The pediatric ER that you were working at, the age range, I've heard some pediatrics are considered up until 16, a lot of them
21.
consider them up to 18.
Birth till 21 is technically, so after you come out, neonate until you are 21, technically you can go to the pediatric hospital. There's a big, ginormous caveat to that, especially working at Children's Hospital, which is a regional medical center. You see the 1 in a million disorders.
Yes.
Honestly, because medicine is advanced so much, adult medicine hasn't caught up with medicine, so people that were like 30, but they're still peds because there's no adult doctor in the world that can take care of them.
Gotcha. What do you miss about pediatric ER?
It smells a lot better.
Really?
It does. Adult hospitals, man, they stink. Kids hospitals do not.
I never thought about that.
So nice. Babies don't stink. Babies don't stink.
Yeah. If they do have some sort of a diarrheal thing going on,
the parents take care of it.
There's also not quite as much as an adult.
Smaller volume, smaller body, smaller volume. This is science,
smell. But what don't you miss about pediatric emergency nursing?
There's really not anything that I don't miss. I really do like the little people. The team that I worked with at Children's was so great, and I miss them all. But I feel very thankful because I get to advocate and take care of the pediatric population in the adult ER. And let's be real, nobody wants to do that.
Oh, absolutely.
Nobody wants to take care of the little bodies in the adult ER. So I'm happy to fill that role and make sure that they're being advocated, taken care of the way they need to be so that they can be safe.
You know, we always go for you. We're always like, hey, I got a little kid and I need some help. It's not that we haven't been trained or we don't know what to do.
There's the little tips and tricks of the trade.
Tips and tricks.
This one I had in the ER a couple weeks ago, and one of my gal coworkers had just given this oral med, and the kid
I was going to ask you about what's a good way to do that.
So, first of all, this kid had steroids. Dexamethasone orally is disgusting.
Oh, yeah.
Any oral steroid, they taste really bad. So how can you mask that and get them to swallow it and take it? We have a trick. We give them a lot of cherry syrup. So I would mix the medicine itself in cherry syrup. And she didn't even know that we have cherry syrup for this purpose. So I called down and got cherry syrup. I mixed the medicine in the cherry syrup, and then I gave him a squirt of just the straight up cherry syrup ahead of time. A little bit of the med, then the cherry syrup, then the cherry syrup mixed with the med. The kid took the whole thing down. Maybe it takes 5 minutes versus 30 seconds, but the kid kept the med down, so I didn't have to redo a task.
I had no idea that we had that.
Yep, so we have that, and then there's other things.
That's another thing I can snack on during my break.
Plugging little babies' noses, the obligate nose breathers. It sounds really mean, but when you plug their nose, they cause them to swallow. Or if you blow in their face really hard, they do this and they swallow when they're 2 years or less. There's lots of little tricks that you can do.
One thing that I absolutely hated doing, the nasal washout.
It's torture.
I feel like it's such a traumatic thing.
But my God, they breathe so much better.
I know it. And then the parents are standing back and they're watching you, and you got them all wrapped up, held down and restrained. It's like... going through and they're like, ah!
But they recover quickly because they're breathing.
They do. It's where I think a lot of the counseling for the parents comes in.
I just say straight up, your child is going to look like I'm torturing them, but I'm not. I'm helping them breathe better, so it's going to be okay.
Sometimes step out of the room.
Well, that's I always give parents the option to step out of the room. You don't want to shove them out of the room. They should be welcome to be there, but if they don't want to see that trauma, the kids won't remember, but the parents definitely will remember. Yeah. That's another little tidbit or trick, like asking and assessing if they want to be there. I think that's something that providers forget to do.
I think that the general population wouldn't think is something that a lot of children suffer with.
Foreign bodies. Kids like to put things where they do not belong. My dad at his practice has a jar of things that he's pulled out of kids' ears and noses over his career. And there's little micro minis and little seashells and definitely beads. Kids love to stick up beads. You get to know the alligator pliers really well as a pediatric nurse. Yeah. That's true for adults too.
The foreign bodies that I get called in at 2 in the morning for because they have to do surgery, those are different types of foreign bodies.
Those are different types of foreign bodies.
Those are in places where...
Usually PD people do not put them.
Exactly. I'm surprised that even adults, sometimes I'm like, yo, what were you thinking throwing something that's glass up your rectum? I mean,
try to not judge because you want them to get help, but at the same time, that would not be going up my rectum.
Exactly. When they wake up from surgery a lot, people don't realize a lot of the times that they just had surgery or what the hell is going on. They feel like they're just waking up in the morning. I'm like, yeah, surgery's all over. And they're like, what? And it starts coming back to them and they're like, okay, I put a glass up my ass. And
it got stuck there.
It got stuck there. I was in the ER, they couldn't get it out, and I had to undergo surgery, and now I'm talking to this dude, but, at the same time, totally got to be non-judgmental because people are going to do what they're going to do. As long as they're not harming other people with it, I'm all good with it. You do what you do.
As long as you're okay with the consequences.
Yeah, exactly.
You have to go to surgery,
exactly.
That is fine.
Did you see a lot of unintentional overdoses of kids getting into things?
Oh, yeah. Lots of overdoses, and then there are, unfortunately, younger and younger, I'm seeing intentional ingestions.
Yeah, okay, yeah.
And not just with 16 or 17-year-olds, with kids that are like 10, 11, 12.
You see that and you're thinking, what in the world could have spawned this? And then you start thinking about the bullying that happens and all these terrible things that, you don't have the best coping mechanisms back then.
You don't have a life to say that this is going to get better. You don't have that life experience.
Exactly.
So it's the end. It truly is the end of the world for you at that age.
Any things you see that parents tend to not secure well enough?
I try, honestly, not to fault parents too much for it. I mean, within there are certain obvious red flags, but those child-proof caps that kids are not supposed to bust through, they get busted through routinely. Kids are just really bright, and if they want something, the best thing that I recommend, if you really don't want your child to have their hands on it, don't keep it in the house. Guns, don't keep them in the house.
Absolutely.
Like kids, they're like a toy. They think of them like a squirt gun. Medicines, they think
like candy.
They look like candy because they do. They're colorful and they're fun shapes, and they look like candy. It's not a lot of the times the parents, but then the ancillary people that come in, like grandparents or friends of friends that have their medications not secured. So that would be my PSA to family members and extended family members and friends. Like if you're going to be around little people,
or have them over at your place,
make sure to keep you don't have to go full Fort Knox your house, but make sure to keep things that are in kids' reaches or easily to climb up onto a stool and get them out of the way.
So there's not something you see that gets ingested more than anything else?
Tylenol is always a big one. Tylenol, ibuprofen, or grandma's heart medicine, metoprolol.
Yeah.
I've seen a lot of metoprolol ingestions or other beta blockers, not specifically just metoprolol. Benadryl, as you mentioned, is also a big one. Really, a lot of the over-the-counter things, just because they're very easily accessible.
And very dangerous.
And
high volumes, And Benadryl is pink and looks fun.
It does look fun.
When you have children that come in, they've got injuries, you suspect there might be child abuse. Do you think that is underreported in the pediatric ER or in the adult ER? I would imagine they're kind of more keen to it in the pediatric ER.
I don't think it's underreported. I think the only time that people would miss it is by not undressing their patients and putting them into gowns. So I don't think it's intentionally underreported. I think it might be overlooked maybe because of lack of doing a thorough assessment. And I mean, if a kid comes in for a paper cut or arbitrarily or something else and they might not need to get in a gown, you still want to put them in a gown because that's your opportunity to really make sure that they are safe.
You never know what could be going on.
Because you might not get another opportunity.
A lot of times in the adult ER, you've got older patients. When they pass away, a lot of times the way people process it, they've lived a long life, that kind of thing. With pediatric patients, it's got to be tough losing a child. I mean, regardless, it's tough losing anyone. But with children in particular, what do you do for yourself to process that?
I don't really think there's a lot to make it better. It's just acknowledging it as it exists and then trying to process it as best you can. To be fair, most pediatric ERs, kids don't die in the ER for the most part. Like if you're going to die in your peds, you're going to die in the ICU, you're going to die in the HEMONC floor. You're not going to die in the ER. There's very, very few ER deaths that pediatric ERs see. It happens, but for the most part, we are able to stabilize them and send them to somewhere else in the hospital. But that being said, I've had a couple of pediatric deaths, and it's never, there's not really a way to make it easy. You need to, as a care provider, talk about the things that you've seen that are sad, because if you don't, then it's not acknowledging that they exist, and then you can't cope with it.
One of the things that I have always heard, it's not the children, it's the families. What is your recommendation for handling families?
I love angry parents. I absolutely love them because it means that they love their children. It means that they're there advocating tirelessly and fearlessly for their little babies. If you look at it from where they are coming
Changing
from,
your perspective,
they want what's best, right?
Yeah,
and
absolutely.
I feel very passionately about families are that way because they want what's best.
Have you lived in Seattle forever?
Pretty much, yeah.
Okay. What is your favorite place to eat in Seattle?
You know, I'm honestly, I'm always disappointed with places that I go out to eat.
Really?
I go there and I'm like, I could make that better and it's not going to cost $200 to eat there. So, my kitchen.
Okay, all right. Hey, I'll accept that. Unfortunately, no viewers are going to be able to go there.
Actually, you want to come over? I'll happily cook for you. I'm Greek, so I like to entertain.
Okay, good to know. Do you believe in reincarnation?
I like the idea of it.
Any irrational fears?
Yes, I'm afraid of butterflies.
I
didn't have too hard.
Butterflies?
Which is why I know it's a phobia, because I know it is irrational. It is not psychosis.
But moths, big thick ones, bounce around and make loud noises on the walls.
Be real, butterflies do that too. They're just prettier colors.
They don't hit the wall and go doof, 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 doof.
They'd be a little bit smarter.
Yeah. What do you think is the secret to happiness?
My dad said this growing up: finding something that you love to do and you'll never work a day in your life.
I can't stand this weather.
I can't stand this fucking weather either. I'm tired of the doom and gloom, man. And the Seattle freeze, people are not nice here. Sorry, tech companies, but you have not improved Seattle.
Yeah,
and I'll tell you how I really feel about it.
Be honest. Favorite cartoon character, growing up or now?
Mickey Mouse.
Traveling back in time, say you've got Bayside High in the palm of your hands. AC Slater or Zach Morris?
Zach Morris.
For sure, 100%?
No, I go back and forth. I just like that Zach Morris is a little bit devious.
He's a
little bit more sarcastic. I think AC Slater's obviously more attractive.
Do you watch TV a lot?
Not really. I watch Netflix a lot.
Over the years, series end, what series would you like to see one more season of or to continue going?
Friends. I didn't have to think very much about that one. I've watched it so many times.
People who like Friends are so passionate about Friends. I think I know the answer to this already. If you could make one show a reality and live in it, what would it be?
Ooh.
Tell me it's not Friends.
I feel like that's too easy. I would go for something a little bit more chaotic, I think.
Okay.
Like Bear Grylls or something.
Bear Grylls?
Or what's the show where you're like naked and you're dropped off in the middle of nowhere and you have
Naked and Afraid, I think is
Yes.
it? Yeah.
I want to do that.
What do you order at Starbucks?
Quad tall, 180-degree, no foam, whole milk, double cups, latte.
What?
That's what being a barista for 7 years gets you.
Favorite movie genre?
Probably drama or thriller.
Horror movies. Do you cover your eyes?
Yep, that's why I get along with the children. We have very
similar fears. Guarantee you, kids aren't afraid of butterflies. Are there any things from childhood you wish would come back into style?
Not scrunchies.
Not scrunchies. In the ER, we kind of get acclimated to seeing really weird up shit. You might have someone come out of the room and you're like, oh, what's in room 9? And they're like, guy shot himself with a nail gun in the eye. And you're like, do you know we're out of graham crackers down here? So is there anything that you've just been like, holy shit, I can't believe that happened?
Well, I saw it, and then I saw it a couple more times and realized that it actually is not that shocking. There was a guy that fell asleep with a ring on, did not take it off, and this was an industrial strength ring.
There's industrial strength?
It's industrial strength. In fact, they tried bolt cutters, and actually the urologist said that he'd never seen
one of that strength.
This poor guy was like really uncomfortable, and I was being this awkward girl, like, how am I gonna go in the room? It said like boy problem on the.
I was gonna say, what did it say on the board? Well, that's a good PSA. If you're gonna wear a ring, make sure you take it off when you're done.
Have fun, but do it safely, folks.
Yeah. Also, if you're gonna stick something up your ass, make sure it's got a large base on it, so we don't have to take it out in surgery.
Good tools to live by.
If you're gonna be freaky, you gotta be smart about it, right?
Yes.
Are there any accents that turn you on?
I always like a good British accent.
Good British accent, okay.
But I like the proper British accent, like Mr. Darcy.
Who's Mr. Darcy?
What? Have you never read Jane Austen, Pride and Prejudice?
Howie, first of all, how do you get an accent from reading?
Like, there's several movies that are...
Okay. Is this the right way? Am I going the right way? Say for whatever reason, you were being broadcasted to the entire world, and you had one piece of advice to give all of humanity, what would it be?
Vaccinate!
Okay.
PD nurse, true and true.